Ranking Member McDermott and members of the subcommittee for holding this hearing and allowing me to talk about a Medicare bill that I am promoting. I'm here to discuss H.R. 4277, the Medicare Mental Health Access Act. I introduced this bipartisan bill with my Democratic Representative Jan Schakowsky. Now, Representative Schakowsky has been a leader on mental health care policy. She's a member of the E&C committee, and I want to thank her and her staff for all of their hard work on this issue as well. As you know, millions of Americans lack adequate access to mental health services, and it's especially true for thousands of seniors who age into Medicare every day. The federal government should be working to improve access for these individuals, but sadly, current law does exactly the opposite. In fact, it presents significant barriers to American seniors who seek mental health services. The problem is that seniors have to go through a middleman to get care. And that's because Medicare requires that many services provided by clinical psychologists must be prescribed and monitored by a medical doctor, a doctor who may or may not have any experience or training in mental health care. This supervision requirement is outdated, and it stands in stark contrast to the private sector, in which clinical psychologists are largely allowed to provide treatment independently. That requirement also fails to respect clinical psychologists' rigorous training and licensure requirements, which includes years of study in obtaining a PhD. This requirement is especially harmful for rural and underserved areas like South Dakota. When a physician is not available to oversee a clinical psychologist treatment program, the services are simply not offered. My bill, H.R. 4277, makes it easier for seniors to obtain mental health care services that they need, and it puts clinical psychologists on equal footing with other non-physician providers, like chiropractors and optometrists. They are easily accessible by Medicare beneficiaries. In short, the Medicare Mental Health Access Act amends Medicare's definition of physician. It includes clinical psychologists. This would have the effect of removing the middleman from the process of seeking mental health services and allowing seniors to go directly to clinical psychologists. It's also important to note that while this adds clinical psychologists to the physician definition, it would not allow clinical psychologists to become medical doctors. Rather, it would simply allow them to practice in a more independent way by removing that physician supervision requirement. I'd like to thank Mr. Nunes, Mr. Kine, Mr. Blumenauer, the subcommittee members who have already co-sponsored this important bill. I urge the rest of you to join them because the Medicare Mental Health Access Act represents a huge opportunity for us. It'll tear down barriers for mental health care access for our seniors, where in states like South Dakota, we see it being a real issue for them getting the kind of care that they need. I sincerely hope the committee will take up this bill as soon as possible. And again, Mr. Chairman, I thank you for the opportunity to testify today.
Thank you for your leadership.